Okay, guys, here's the bonus one for you tonight. The topic is the article explores the challenges and importance of discussing death, particularly in healthcare settings. Okay, so that's discussion D for you tonight. That's what we're discussing. Okay, here we go. The article explores the challenges and importance of discussing death, particularly in healthcare settings. The author, a medical student, recounts an experience in an emergency department where a doctor abruptly asked the patient about resuscitation preferences, highlighting how poorly these conversations are often handled. The piece emphasizes the uh, desperate, de- desperate dealing with life and death daily. Healthcare professionals often struggle to talk about mortality. The the reluctance stems from a culture that celebrates life and views death as a future. However, the article argues that no, acknowledging mortality is crucial, especially for patients facing serious health concern or health conditions. It discusses the complexity of end of life decisions, including advance directives, power of attorneys, and living wills, which can be overwhelming for both patients and providers. Cultural attitudes, family dynamics, and emotional responses further complicate these decisions. The article advocates for better training for medical professionals to navigate these conversations with sensitivity and clarity. Studies show that early exposure to palliative care and clear communication about end of life goals improve patient satisfaction and allow individuals to have more agency over their healthcare choices. Several societal attitudes contribute to the stigma surrounding discussions about death. Cultural uh, avoidance. Many cultures celebrate life and view death as something to be feared or ignored. This leads to discomfort in openly discussing mortality. Death as future, or death as failure. In medical settings, death is often seen as a failure rather than a natural part of life, making healthcare professionals uh, hesitant to address it directly. Fear of emotional distress. People worry that talking about death will upset themselves or others, leading to avoidance. Lack of education. Many individuals lack knowledge about end of life care, funeral practices, and grief, making conversations about death feel intimidating. Media influence. Media often portrays death in a dramatic or tragic ways, reinforcing fear rather than acceptance. Religious and spiritual beliefs. Some believe some belief systems emphasize an afterlife or spiritual consequence, which can shape attitudes toward discussing death openly. Okay, generational differences. Older generations may be more familiar with death due to past experiences while you were younger. Younger generation who have benefit from medical advancements may be less accustomed to confronting mortality. Breaking the stigma requires open conversation, education, and a shift in cultural perspectives. Would you like to explore strategies for focusing more comfortable discussions about death? Fear of death, also known as Thantopia, Thantopia can stem from several psychological factors. Fear of the unknown, the uncertainty of what happens after death, can be unsettling, leading to anxiety, loss of control. Death is one of the few things in life that cannot be controlled, which can be distressing for some individuals. Okay, external anxiety, questions about the meaning of life and whether existence has a purpose can contribute to fear of death. past trauma, experiencing death of a loved one, or witnessing a traumatic event can intensify fear of mortality. Religious and spiritual beliefs. Some belief systems emphasize consequences after. Okay, consequences after death, which can either alleviate or heighten fear. Social and cultural influence. Societal attitudes towards death include taboos and avoidance can make decisions about mortality more difficult. Personal health concerns. Individuals with chronic illnesses or health anxieties may experience heightened fear of death due to their vulnerability. Okay. Psychologists suggest that addressing these fears through therapy, mindfulness, and open discussion can help individuals develop a higher perspective on mortality. Would you like to explore coping strategies for maintaining this fear? Okay. Cultural beliefs play a significant role in shaping how individuals perceive and fear death. There are some ways different traditions influence attitude towards mortality. Mexican culture, Dia de los Muertos. In Mexico, death is not feared out of celebrated as part of life. The Day of the Dead, a vibrant festival where families honor deceased loved ones with altars, food, and decorations. This approach fosters acceptance rather than fear. Hinduism. Hindus believe in reincarnation, where the soul migrates to another body after death. The quality of life, quality of the next life depends on the one's karma. This belief can reduce fear and death, as death is seen as a transition rather than the end. Christianity and Islam. Heaven and hell. Both religions emphasize an alternate life where souls are judged based on their deeds. The promise of eternal peace in heaven can provide comfort, but fear of punishment in hell may heighten anxiety about death. Okay, Buddhism cycle of rebirth and nirvana. Buddhists view death as part of the cycle of rebirth. The ultimate goal is to attain nirvana, escaping the circle of suffering. This perspective encourages mindfulness and acceptance of mortality. Chinese, Japanese. Traditional ancestor worship in many East Asian cultures. Ancestors are revealed and ridiculed, ensure their spirit are honored. This fosters a connection between the living and the dead, reducing fear by emphasizing continuity. Western culture, death and taboo. In many Western societies, death is often avoided in conversation. Contributing to anxiety, the emphasis on youth and longevity can make mortality seems more frightening. Understanding these perspectives can help individuals navigate their own fears and find meaning in mortality. Would you like to explore how these benefits include grief and mourning practices, culture beliefs, and shape grief and mourning practices in profound ways, influencing how individuals and communities process this loss? Here are some key ways different traditions impact mourning. Expectations of grief. Some cultures encourage open emotional expression while others emphasize solipsism. For example, in many Latin American cultures, public displays of grief are common, whereas in some Eastern Asian countries, cultures, restraint is valued. Funeral rituals, the way a person is honored after death varies widely. Hindu funerals often involve cremation and uh, rituals to guide the soul, while Islamic traditions emphasize swift burial and prayers. Mourning periods. Different cultures have specific mourning durations. Jewish traditions observe Shava, a 7-day mourning period, while some Buddhists customize involve extended ceremonies to help the deceased transition. Beliefs about the afterlife. Views on what happens after death influences mourning in Christianity and Islam. Belief in heaven and hell can shape grief, responsibilities, while in Hindu and Buddhism, reincarnation provides a different perspective. Community support. Some cultures emphasize collective mourning, where families and communities come together. Grief. African American homegoing celebrations are vibrant events that affirm these deceased journey to the afterlife. Symbolic practices. Many traditions incorporate symbols such as wearing white in some Asian cultures or lighting candles in uh, Catholic mourning rituals. Understanding these diverse perspectives can help foster empathy and appreciation for different mourning concerns. Would you like to explore how grief counseling adapts to culture differences?